this is Jessica DeMassa, and I'm reporting from HIC 2017. We're here at the HISA Studio booth with Peter. Can you please introduce yourself for everybody watching?
Yep. Hi, I'm Peter Williams. I'm the Healthcare Innovation Advisor with Oracle in Australia.
Oh, fantastic. So tell me what you're working on. What are you looking at right now for Oracle?
We're looking actually at a lot of things. One of the reasons why we're keen to sponsor this conference, we're doing the hacking health stuff, is because there's just so much happening around at the moment. You know, whether it's precision medicine, whether it's Internet of Things, whether it's analytics, it's an exciting time at the moment.
So tell me specifically with Australia, because you know these videos are going to go viral. So let the world know what's going on in precision medicine and what's going on in health informatics in Australia in particular. Give us like a state of play.
Look, to be honest, in Australia, we're probably, just at the start of that S-curve for that. There is, you would have seen Richard Ashbury presented around the stuff that's happening here in Queensland with precision medicine, and other states are starting to look at that. In other parts of the world, like the US, you've got people like MD Anderson, Penn Medicine, those sorts of people who are probably realistically maybe 2 or 3 years ahead of us in that, but we're catching up very fast. There's an expectation that if you want to make a real difference, then the opportunities around genomics, around individualised care, as I'm going to give this drug because actually I don't think it'll work for you, I know it'll work for you, I understand your profile, I do, those sorts of things have a huge impact, well beyond the technology impact.
So what do you think is going to be driving some of these changes forward in Australia? Like, is the climate right? Is everybody kind of jumping on the bandwagon here from a technology standpoint? How are things different than maybe they have been here?
Look, I think very timely this week we just had the digital health strategy come out, and that is very much focused around getting a lot of those foundations in place to be able to do the sorts of things I've just been talking about. Paul Keating said it's the economy stupid. In healthcare, it's the data stupid. It's about getting that information together, drawing it from a whole range of sources. We talk about genomics, even things like patient experience. Health is under pressure. Costs are rising, cost of technology, cost of ageing, cost of chronic disease, cost of consumers wanting a lot more. You talk about the ageing population, the expectation of the baby boomers is going to be very different to our grandparents. I'm in charge, I want to control this, so they're much more demanding on that. Being able to deal with all that, particularly for government which is funding all this, we're 9% of GDP, the US is 19%. We can't afford to be there, so we've got to be smarter. So looking at federal government putting out a thing around digital payments and modernising Medicare, where they're looking to move to value-based payment. I'm not paying you for the services you're doing, I'm paying you for looking after patients better. All of those sorts of things. To do any of that, you need the data. And so you need it accessible, you need it at a high level of quality, you need it manageable. Cyber security. It's great to talk about data if you're a tech person. If you're a person in the street, who am I going to trust to manage my information? How am I going to have control over that? All those sorts of issues. Now, there are answers to all of that, but that whole process and discussion and engagement around that needs to happen, and we're starting to have the dialogue, and the strategy, I think, is something that is going to pin that and put that in front of people. The fact that all of the health ministers have actually signed off, put their government logos on that, saying this is something we're collectively committing to. They've still got to do it, but that's a very good start. And also, working for a tech company, the fact that consciously engaging with industry around that, knowing we need to find where are good ideas, which may not be in healthcare. What's happening in telcos, what's happening in banking, what's happening in other sectors that we can bring in, particularly when you start to look at things like chatbots, AI, all that new tech. There's a reason why we sponsored Hacking Health, because people can look at a company like Oracle, it's a big multinational, think, oh, that's in the old tech world. But the reality is we do lots of stuff with startups, we're doing lots of stuff with those sorts of new businesses, new models, because everyone wants, quick to success, fast to fail, figure it out, move on. That's the technology world we're in now.
Give me your perspective a little bit on the startup scene here in Australia, particularly in health tech. What's going on? Is it emerging? Give us a sense of what's happening here.
I'm probably the wrong person to ask. My colleague, Suren Dale, who would be a good person because he actually had a startup which was anti-sponsor startups as an Oracle person. We have a lot of partnering relationships at the moment and are increasingly being encouraged to work with those smaller groups, more agile,
Sure.
more innovative, those sorts of things. I don't get the sense, to be honest, that we're anywhere near, like, if we were sitting in San Francisco, it would be a very different world. But, as I say, that's why we're sponsoring Hacking Health. We want to encourage that sort of activity, that sort of innovation. Sure. And we're giving away people cloud credits to go and do it,
Right.
Teach us something we don't know.
So last question for you. As from a big technology company, you obviously travel all over and you see a lot of different health tech that's out there. What has you most excited? What do you think has the potential to really transform the way healthcare is consumed?
The most interesting thing that I've seen recently is some work that we're doing with the NHS in the UK, a thing called the Maternity Assist Program, which is all about using social media to work with pregnant women into early childhood and how you support them, help them set up community networks, how you integrate that with their healthcare. Really innovative sort of stuff that is well targeted to that group. People live on their phones.
Yeah.
Let's deal with that. To me, that's more interesting than just the pure things like precision medicine and technology and whatever. It's interacting with the way people live.
Well, yeah, and it humanizes it, doesn't it? Right. No, that's fantastic. Well, thank you so much for joining us and for sharing your perspective with us here at the HISA Studio. I'm Jessica DeMassa, reporting from HIC 2017. Thank you.